You're listening to the Sick and Good podcast. My name is Dustin Messick. I'm a registered dietitian nutritionist and a cancer survivor.
My name is Colin Goodwin. I'm a clinical psychologist and a cancer survivor. We're promoting wellness by having discussions on screening, treatment, and recovery throughout the cancer journey.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regimen.
Mary Mathew is a licensed psychotherapist and founder of Beyond Cancer LA, a private practice dedicated to serving those affected by cancer. Her private practice offers counseling services to cancer patients, survivors, and caregivers, focusing on issues such as depression, anxiety, and post-traumatic stress. Thank you so much for being a guest and welcome.
Thank you so much for having me.
We are always so interested in how then those in the cancer field then get into the profession. And I wanted to ask, what brought you into the cancer field?
So I was actually a psychotherapist before I started the cancer journey. And at the age of 30, I was diagnosed with cancer, and it really threw me off guard. The moment that I realized that I'm going to be doing this for sure is during my second chemotherapy session. I was sitting in the chemo chair at Cedars-Sinai, and there was a very nice, very friendly psychotherapist that came up to me and introduced herself as a therapist and wanted to initiate therapy right then and there. And at the time, I had steroids coming in, getting pumped into me. I don't know what's going on. I'm terrified. I have a 1-year-old at home. And I very, very foolishly, I asked her, "Have you ever had cancer?" And she said, "No." And so I thought to myself, and like I said, this is very foolish. There's a lot of psychotherapists out there that are highly qualified to do this work. I just thought, nope, not happening. Like I need to talk to somebody who understands what's going on. And as that chemotherapy session was progressing, there were all these volunteers that were coming, and they had a basket in their hand with fruits and snacks and beverages, and they introduced themselves as volunteers who were also cancer survivors. And then all of a sudden I had all these questions for them. How long did it take for your hair to grow back? How long were you sick? Did you have a child at the time? How am I going to go home to my 1-year-old and parent? And I knew right then and there that, hey, first of all, cancer patients want to speak to other cancer patients. And that was my quest to start looking for a therapist that was also a cancer survivor. And I really struggled to find one. And so I actually didn't find one. I settled for somebody who wasn't. She's still my therapist. She's excellent. But that's how I knew that I was going to get out of this situation first, give myself some time to heal, and then eventually start working with cancer patients.
It sounds like you really saw that need, and it was something that you wanted to have that connection and understanding from a therapeutic standpoint, to then really have that be a way to feel like you could then heal and be understood.
Yeah. Oh, absolutely.
Well, I understand that you recently presented on mental health and cancer at the Cholangiocarcinoma Foundation Conference. Can you walk us through some of those talking points from that presentation?
It was an hour-long presentation, so I'll try my best. It started off at most psychotherapy sessions that I have usually start off with very common themes. People come in and they are confused. The population that I work with usually come in and report the same things. I don't understand how this can happen to me. I'm young, I'm healthy, I did all the right things. Why me? I don't smoke, I don't drink. I have been on the organic bandwagon for, 10, 20 years. And how could something like this happen to me? And so I addressed that in the conference. That's how I started off, because most people come in and they're really shocked and confused. and want question or have all these questions and don't have answers. And unfortunately, medicine, we're not there yet. So we don't, for some cancers, we have some idea, not for every cancer, definitely not specific to the individual. Sometimes it just doesn't make sense. So there's usually fear over the new diagnosis. There's fear over the treatment plan and the side effects. I think oftentimes we come into this journey and we hear cancer therapy and automatically we think we're going to die. And, a lot of it has been dictated by the media. I've never really watched a movie where there's a cancer patient that survives and has a happily ever after. And so that's the first and foremost is that we address these things. There's usually a whole lot of anxiety that comes into the picture. And so that's something that's heavily discussed. That was actually, I'm going to pause right here because anxiety is something that I spent a great deal talking about at the conference, and just understanding anxiety, I think, through a healthier, more humanistic perspective. A lot of us come in with a lot of anxiety and we might report it to the doctor. And I love doctors and everything, so don't get me wrong. And there's a time and place for medications and everything. But we come into this diagnosis and we're reporting things like depression and anxiety and the inability to fall asleep. And we leave usually with a handful of medications and prescriptions. And I spent a great deal normalizing anxiety and truly dissecting it and offering a healthier perspective on it. And that our brains are wired for survival. We want to survive. And so when we hear of a life-threatening disease, we automatically go into the state of anxiety. And it's there to protect us, honestly. It's that anxiety sometimes that drives us to go into the next chemotherapy session, knowing that we're going to leave really in bad shape. It's the anxiety that pushes us to go into that next PET scan or CT scan and do the things that we need to do to get on the other side. And so developing a healthy understanding of what anxiety is will then allow us to manage it a little bit better without the overuse of medications that we often see now. And so that there is a great deal of time understanding that and the root of that. There's always fear of relapse and reoccurrence. I think, and I'll share this story from my own experience. I remember the first time I went into a support group for lymphoma, and I was at the halfway mark, and I had my midway PET scan, and the doctor came in and he said, there's a significant, improvement, over 50%. We can't really tell you. I don't know. I had a 14 by 10 size, mediastinal mass in my chest cavity. And so he said, there's just significant improvement. We're on the right treatment plan. This is what this lets us know. And I was so happy. I was elated, like, okay, whatever this was and however bad this chemotherapy is, it is medicine. I really learned then that, you might walk in thinking, oh, this is toxic and this is poison. But I learned then that chemotherapy is medicine. It is a real medicine, and it puts people in remission and it saves lives. And so I started to develop a healthier mindset around chemotherapy. But I'll never forget when I walked into the support group and I sat there with my amazing news, and the girl right next to me had the same exact cancer, same exact age, same profile, but she had relapsed. And prior to it, I knew nothing about cancer. I knew nothing about the possibility of relapse. And I freaked out. I totally freaked out. I was like, wait a minute, I could be doing all of this just to relapse. And it was something that I'll never forget, just really struck me. And so the fear of relapse is always going to be there with any cancer diagnosis. And these are things that come up in every single every single psychotherapy session. I also spent a great deal talking about maladaptive coping skills that can happen with this diagnosis and post this diagnosis. And that can look like a host of things. Eating disorders, which I'm glad Dust is on here, is something that I often see. And I see it in a lot of women who maybe have a history of an eating disorder, even if they, had the eating disorder in their adolescence and now they're in their 40s and 50s. And it usually starts from this need to control. And so they usually come in with a super healthy lifestyle and healthy whatever, but something glitched and something went wrong. that caused cancer. And the first thing that they tend to do is latch on to their eating. That's the one thing I can easily control. I can cut out all these things from my diet, and then maybe I can control the outcome of whether I'm going to relapse or not. It starts off really cute. It's very subtle. I stopped eating all these highly processed foods. Excellent. That's what that's awesome. But then, it turns out this causes cancer and that causes cancer. Did you know this causes cancer? And then we're like in full blown now monitoring every single thing that comes in and out of our mouth. We're not doing well. It's affecting our mood. It's affecting our sleep. And then we're back into like the loop of an eating disorder. Substance abuse is obviously another thing that can come up post cancer as people are trying to adjust and adapt to their pre-cancer lives.
What do the stages of grief and adjustment look like for people with a new cancer diagnosis?
So just like everything that we know about the stages of grief, which are, very straightforward: denial, anger, bargaining, depression, and acceptance. So typically people will come in and there's this sense of denial. Maybe the doctors got this wrong. Maybe if they rescanned, maybe it wasn't my scan. Maybe they messed up. People mess up all the time. And so these things are natural thoughts that happen. And then once we come to realize that this is a real thing, this is my diagnosis, my reality, oftentimes we experience anger. I know for me, I was a really angry person when I woke up and realized, oh my God, this is a nightmare. It's like I just woke up from this nightmare. Bargaining. I will do whatever it takes to get out of this. So I hear this all the time. I swear I am going to church every single Sunday. If God gets me out of this thing, I'm, and there's this bargaining that's happening. I will never eat a chocolate bar again. I I will do all these things. I'm going to bargain my way out of this. And then when you realize that life doesn't work like that, then we're hit with the depression. And then obviously hopefully we get to a point of acceptance that this is my new reality, that I have to start creating a new life with cancer in it, that there is really no coming out of it. Even in the state of remission, you're always in it. I mean, I see my oncologist every 6 months. I am sure every single person that has had this diagnosis realizes they're never actually out of it. Oftentimes we are led to believe that once you're done with treatment, you are done. You're good to go. And then you realize, oh no, the doctor wants you back in 3 months for a follow-up. And you're like, why? I'm done. And no, it doesn't work like that. And also I want to make this a point. This is not linear. So we don't just go through these stages of grief and then we're done with them. We're just like cycling through them, and it comes in waves. Just like any cycle of grief, actually, in any context.
Yeah, I think that acceptance piece is really challenging because there's just that thought in the back of your mind, like, what if this didn't happen?
I like to think of acceptance as like something that's just chipped away at too. So it's not like I'm going to be 100% acceptant of everything that's happened, but maybe it's just being able to then sit with it for that minute and recognize that this is my reality, rather than trying to push away and say like I can't feel this, or I can't experience this, or this thought is too painful, or whatever that may be. That's that pushback from the acceptance. So. Understand that you spoke on some, differentiation between like a internal and external coping skills. Wanted to just have you speak to that.
Yeah. So during intake, this is always like a challenging exercise for a lot of people. I'll usually ask something along the lines of, "What are your coping skills? What do you do? What do you do to get out of these scenarios historically?" And then I'm hit with like, a list of all of these, what I call external coping skills. I exercise, I like reading, I knit, I do all these like things that are physical, and it's all wonderful because that's what we were taught. That's like the easy way out of actually it's a healthy way out, but it's like the easy thing to do. Go for a walk. We know that that's like going to be successful. And then I always ask, well, what if I took all of those things away from you? The ability to exercise. If you're a runner, what if I took away the ability to go for a run, which happens all the time in my practice, like all the time. People come in with this, like, oh, I love that adrenaline that I get from running. Well, what if you couldn't do it anymore? What if you were in the hospital?
Yeah, just yoinked from the.
What if you lost legs as a result of this? Which I unfortunately see that too. What if you couldn't knit anymore because of neuropathy? What if and then they're like, well, what do you mean? And I'm like, those are your internal coping skills that I'm trying to pull from. And most people will respond, well, I don't know if I have that. I don't know what is that? What is an example of that? And to me, an internal coping skill is well, first of all, requires a lot more internal work to understand and identify. But if I had to break it down to like one very simple concept, it's the ability to positively self talk. It's like this really healthy mindset of, and it requires you to let go. There is a loss of control in that. I have no idea what's going to come next, but I know that I'm going to have the tools to get out of it. I know that there's going to be an end to it. And it's this ability to tell yourself that. And that starts from, I think, from early on in childhood, and is something that a lot of people really struggle with, whether their core beliefs are that they're not worthy of it, or that they're not good enough, or that they can't get themselves out of situations. And that's something that I spend a great deal working on with people, because that is a terrifying thing. What if I couldn't do all the things that I've always been taught to do to self-soothe and to regulate and to cope?
I find that like there's maybe a subset of patients that when there is that stressor, and cancer is a big one, there is like a discount or a minimization of like what they are doing. Like, what have you been doing to cope? It's like, I've been doing nothing. So it does take a little bit of a coaxing them to talk about, well, what does it really look like when you have an unpleasant thought or unpleasant sensation, or maybe just that denial comes up, and that grief process. What is it that you're actually doing in that moment? Are you just sitting down and resting? Yeah, that's a coping strategy. Like, resting is important. So I always find it interesting that there are those that just aren't able to then articulate what they're doing, or maybe it's that they feel like they're not doing enough. I think that's probably more of the thought that, like, I'm not doing enough because I still have these feelings, because I still have these thoughts, because it's still here.
Right. And this is more about allowing yourself to get comfortable in a very uncomfortable space. In that I am coping right now by being still, and I'm allowing myself to feel these things, and I'm not going to change them, actually. And there's actually nothing wrong with that. I know it might make other people around us, especially our loving family and friends, very uncomfortable when they see us like that. But it is, as long as you're aware of it and conscious of what you're doing, and it's done in a healthy way, I think it's beautiful. I'm self-regulating internally. Like, I am trying to accept where I am. I accept that there is going to be some level of depression, some level of anxiety. I'm not going to be in this space forever, but right now I am, and I'm trying to be okay with that.
Can you explain a cancer lens and some of the narratives that you've encountered?
Yeah. So cancer lens is something that I made up. It's a term that I made up, so no one can Google this one. This is all, but it's just based on a lot of observations over the years, and even in my own personal life, that sometimes post-cancer life, or even in the middle of treatment when things are going really bad, sometimes people come in and they report these moments of just joy, and in a way that they've never experienced before. And usually it's in the context of like being very, very, very aware of where you are in the moment and where you are in space. And that kind of joy it pushes you over to the point where everything makes sense and everything is worth it. Even if it lasts for like a few minutes. And I'll share one of my stories in maybe another one from a client that I've had. So I remember, so I had radiation to the chest, and before cancer, I used to walk 7, 8 miles a day with a weighted, 25-pound weight vest. And so walking and regular exercise were just part of my life. It was just what I did. And I will never forget this. I was walking with two others, and we were going up what I call a big mountain, but it really wasn't. It was just a little hill, and I just couldn't do it. I could not do it. I was wiped out. I was still recovering, so I had the fatigue. I had this radiation to the chest, which definitely had an impact on me. I was done with chemo, and it was not me. I was somebody that was used to rigorous exercise, and I was young, and I couldn't do it. I just sat there at the bottom of the hill, kind of huffing and puffing, thinking, "Oh man, why did I drag these people out here for a walk? I can't even walk. This is ridiculous." And they were really very nice. They were like, "We can just head back. Like, we don't have anything to prove to anybody. You don't have to prove it yourself to anybody." And I was like, "Yeah," I was ready to call it. And then all of a sudden, I felt this gust of wind, and I felt it up my legs. And then all of a sudden I was like energized, and I was like, "No, I got this." And I did it, and we went on, and I dragged these poor girls like 5 more miles. And so something had shifted there. Like, what happened? There was the physical sense, and there was the physical elements that for sure were there. They were present. I mean, I'm not going to deny that there's fatigue and all of the things that come post cancer treatment. But there was something else there. And it was this consciousness that I had gained in that moment of where I was in time, of the elements around me. Something about that wind. And I looked at them, and I was like, "Did you guys feel it?" And they were like, "What?" And I was like, that like breeze. And they were like, "Yeah, yeah, yeah, we felt it. Whatever, yeah, of course we felt." But they didn't feel it the way I did. I had this like heightened experience that I was aware of at that moment. Like, oh man, they don't get it. They don't get it. There was a breeze, and it just sounded so weird to them, but it gave me this different perspective and this ability to go on. And I hear it all the time for my patients. One patient went on a cruise post stomach cancer, and she looked out, and she said, and the way that she described it, I was like, "Oh, that's the cancer lens." Her dad was a physician, and he had her in treatment very quickly, and she was on a cruise with her whole family, and she looked over, and she said, "I saw my dad, and the sun was just like setting, and his silhouette, and I just felt so emotional, and I cried, and I thought, oh my God, I'm so thankful for that man. I couldn't have gotten here without him." And that feeling, I never want it to go away. Is this going to fade? People always ask that, is this going to fade? Or is this, and I'm like, oh man, like that's the cancer lens. That's this cancer perspective. And sometimes it just hits us when we're not really expecting. It's not like we're going out and looking for it, but sometimes we're just moved by where we are and what is happening around us, and this like, I'm alive, and I'm alive to see this and witness this and feel this. And it's that awareness of it. That's the cancer lens.
One thing I was thinking about as I was listening to you talk about your personal experience with that cancer lens was that like having an afterburner, or of getting that second wind, or the way you described then having some of that clarity. It just made me think of like the movie The Matrix, where Neo's finally been seeing everything for what it is. He's having that clarity, that powerful moment, and maybe even that epiphany of where they are, and where you are, or whatever, where we're going to refer this as, like being in that present moment.
Yeah, that's exactly. And the matrix often comes up in therapy, and that's exactly what it is. It's just being very aware of where you are and the reality of everything, and this veil that's like lifted over your eye, and you can see very clearly. I'm not in the hospital right now. I am walking, and I just felt that breeze. And when you have experienced something like cancer, it you're very much aware that when you're not in it, you're not in it, and we're thankful for that.
Yeah, this part of the discussion actually kind of reminds me of
after doing chemo in the hospital for a month, and it was one day I just looked out the window and there's these beautiful mountains out the window, and I was like, wow, there's like an outside. Look at, there's this like big world out there, and it's like endless, and it was like this big expansive feeling. It was like almost I forgot about the world outside because I was just like trying to survive.
Oh yeah, that's a good way of putting it. Like you become so like, blinded by the process that you're not necessarily open to those other things that are around you, and even just being able to see like the mountains or the nature, you're like blown away by it. You turned into Keanu Reeves right there.
Yeah. Yeah. And that's exactly what it is. It's like really realizing what's in front of you. You might talk to a nurse and be like, "Do you see those mountains? There's a world outside." And they're like, "Yeah, all right." But they don't see it the way that you do. And that is the cancer lens, is very unique, and very special.
Yeah, or eating food outside of the hospital after being in there for a long time. You're like, oh my gosh, this bean dip is incredible. Are you guys tasting this? And everyone's like, it's bean dip.
Don't get Dustin started on bean dip.
Exactly. Oh man, I think we're there. Yeah, exactly. That's exactly what it is. It's like such a gift. I'm going to go out and use that word. It's a big loaded word, but it is a gift. It's a gift to be able to see the world for what it is and to appreciate it. And
It's like that appreciation for like the smaller things in life.
absolutely.
Well, I'm curious if there's maybe some common like comorbid diagnoses that you experience in your private practice. I think we talked about that, or maybe touched a little bit on, some restrictive eating habits, or just how that can contribute to eating disorders. But wanted to see if there's maybe other themes or other than diagnoses that you commonly see in your private practice.
Absolutely. I think the two most that we see right off the bat is going to be depression and anxiety. There's got to be some acceptance. There's going to be some level of depression and some level of anxiety that comes with this space. Along with that, there's sometimes substance abuse. Sometimes we see some sleep disturbances that might really get into the sleep disorder category, like diagnosable sleep disorders. Those are some of the most common eating disorders.
I'm curious now that you've had the chance to, pivot and create like your own space within Beyond Cancer LA. What do you find the most perhaps gratifying in offering what you were looking for in a therapist?
That's a really good question. I think just the ability to get into the space and meet people where they are, and not necessarily have like this list of things that we're going to change, but just meet them where they are and love them there, and then work from there. Like I see you, I hear you. I'm not here to necessarily change everything right now. That's not what we're doing right now. But I'm in this space with you. And sometimes people come in and unfortunately they are terminal. And sometimes just meeting them there and offering and holding space for them, where I think a lot of people are really uncomfortable and they don't have that person to talk to, their family and their friends. The acceptance piece is really difficult. And just allowing them to exist there and sitting with them there, despite the discomfort that might come with that, is probably, I'm going to say, like the most satisfying and rewarding thing. And then also the ones that are moving past the treatment phase or in the treatment phase and just holding space for what that looks like, but also offering a sense of hope. And for everybody, it doesn't matter what phase you're at in this cancer journey, but offering a sense of hope that things are going to change, that there's a life outside of this that you can create. And we have to create it with cancer in it. Cancer has to be woven into it, whether that's going to appointments for the rest of your life, or continuing treatment for the rest of your life. But it's a space of creation. I often tell people that this phase of life is where you get to create. And I have this analogy where I say sometimes the building has to come down for you to build, the house that you were born into has to come down for you to build the house that you actually want. And so just offering that sense, and kind of the greatest joy I get out of this work. It's something that I had wished. I remember I come in from the psychology field, and I remember a lot of my own therapist friends didn't quite get it. I remember one time I went in and to work, and I was speaking to a coworker, and I think I was like 3 years out, and I was they scanned me for 5 years, and I had all the scanxiety. And in real life, you can't just take off of work because you have scanxiety for a week. It doesn't work like that. And so I had to go through the whole work thing, and she used the classic CBT on me, which was just not appropriate for this space. But she's like, well, all your other scans came out clean. What makes you think this one won't be? And I'm like, oh man, you totally missed the mark. Because, these doctors, they don't write you up for a scan just because for fun, we're going in there to confirm continued remission or a relapse. That's the only reason why we're scanning, right? And I just remember thinking, oh, okay, she just doesn't get it, missed the mark altogether. And so one of the greatest joys I get is just the knowledge of what not to say and what to say, and just holding space for whatever the outcome is going to be.
I like that a lot. Just being able to then maybe recognize, from that other perspective of, kind of what is maybe more of an appropriate or welcomed than inquiry or question. One thing I was just then reflecting on is that experience of scanxiety is like, oh, well, just being able to challenge it is going to be able to then take it away. Like that's not necessarily going to be too successful because, you did have to have that scan, for 5 years after, your treatment. And that you did have those experiences of others that had relapse, and that is a real possibility. And it's not based or rooted in, fantasy. There is that, just to put it simply, of that real component to it. So, gosh, I could see how that was just not necessarily too helpful in that moment. Just to be like, well, just don't think about it. Just stop it.
It hasn't happened already, so you're good, right? And I wish it worked like that.
Well, Mary, wanted to thank you so much for being a guest and to then just share your perspective on, individual psychotherapy and how you've been able to treat those in the cancer field. But thank you so much.
Thank you so much for having me.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey. Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media at Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.